educators or a parent coach, are they being recognized or are they being appreciated as equally as psychologists or psychiatrists? Are there any kind of difference being given, appreciation or recognition given?
Yeah. I mean, many of them are not aware about special educator or something like that. So when you say special educator, they will first thing they will ask is like mental kids children. I mean, you handle mental kids. Like what mental kids? And counselors, if you refer yourself as counselors, they will consider. I will consider from like some party counselors like. So they ask which party you have joined. Like not that counselor. Psychologist. Very rarely they are aware of. So they consider as thing as psychiatrist. So that's how you give prescription. First thing is like, can you read my face? What am I thinking?
Read my mind.
Mind and all those things. And no. Even though the efforts, the learning, the training is entirely different of a special educator from a teacher.
Yes.
But recognition is, they are only known as part-timers or somebody who has just taken up the course and they have come out. But the hard work, the way of teaching, the way approach they take up, it is entirely different from a teacher. Many, I mean not like all, but few of them do, whose children have shown improvement because of special educator. They come out, they form a groups. That is how so many awareness programs are happening around, where now special educators have got some recognitions.
Good.
Still it is very late,
It's
and
still
it's better. It's coming up. Same thing with psychologists now. People have come to know psychologists do not prescribe medicines.
Exactly.
They do only the counseling, they might do few therapies. Psychiatrist is a person who has done MD and MBBS and they are eligible to prescribe medicines. Though they also work with mind, even the psychologists, the difference is only this much.
Oh. And as a special educator, like have you faced any support from your any problematic parents, like not problematic parents, who are less considerate or less understanding, like support basically what I'm talking about. Like have you got enough support from the parents with the children who have special needs? Have you got?
See, again it depends. Few parents who were able to understand and accept. So they came forward, they were ready to take their child for remediations to a special educator, whatever it was required. Few still denied. They were in still denial. They were not ready to accept that their child had any issues. Immediately they said, my child is normal. A child with learning difficulties doesn't mean the child is abnormal.
Exactly.
The child has only issues in the way that the child is taught. His way of learning might be different. Everybody has their own way of learning.
Learning style.
So only the learning style is changed. It makes a difference. And there might be a child, since ultimately for parents and everybody is the grade or passing. Whether the child is learning or not, the child is passing. So some of the student is in 8th, but the level of student might not be somewhere near to 6th also. But that child is in 8th standard. Because of negligence of the parents, they did not accept at very young age that my child, why he is not scoring. For them what mattered was promotion. The child is promoted, right? Then many schools ask the students to leave who are having issues.
Okay.
So they have to go to open schoolings, all special schools and all to complete their 9th and 10th.
Oh.
So acceptance of parents is very much essential because not everything can be taken care in the school or the centers. Something has to be done at home also.
So if that is the case, any parents we're not able to accept the fact where you're not able to gain their support, what would you tell those parents through this video? What would you suggest or advise or throw some kind of limelight, throw some kind of highlights for them to accept the fact they do, kids with special needs do need help. That is why special educators are there exclusively. So what, in your words, what would you tell them?
I would only say you know better how and what your child is. If you find there is consistent change in the child's behavior or drastic reduction in the scorings of the child, find it out. If you are not able to figure it out, don't yank or shout. Give them that space to open out. still you feel your child is not coming up, suddenly there is change, drastic change in the behavior or fall in the grades, take them to your school coordinator or school counselor. And
school counselor.
Yeah, if required, they might refer to places where they take up assessment on finding it out what is happening with the child. It doesn't mean if your child is having problem, the child is having any kind of major problem, or your child is abnormal, or your child is mentally retarded. Everybody knows only those terms. It's nothing like that. The child might have less intellectual, which can be worked on. The way of child's learning is different. That can also be worked on. Little support, extra care might bring out the
what
changes.
matters.
All thing is only acceptance and not turning your face off. Just by closing eyes, the problems are not going to be solved. Your child is not going to stop growing. Just because I have closed my eyes, that my child is not going to stop growing, right? Years will go on.
Yes.
I say, I'm in older age, when I see my child having the same issues, at that time it would be very, very difficult to help the child.
Exactly.
So it's only acceptance. I need to know, I know my child is going through some problem, and I am here to support.
And there are people to help. That is what.
That's all. You need to find the proper channel. For that you have people like us who are working on spreading awareness. You can reach us, you can reach your school coordinators, your counselors. They will have the contacts of people whom they can refer to. Please go and finish. Do that. Just for name's sake, I went yesterday and I showed my child is normal. Your child is always a normal. Only something is missing that can be taken care of.
Missing part can be fixed.
That's all. If you leave it like that, nothing is going to happen automatically. Some parents are, once they'll go to school, everything will be fine. Once they'll go to big classes, he will be fine.
That's not the
cannot happen.
fact.
Just, for example, for all the mothers, you soak rice, keep it on the gas, but without turning off the gas stove, and you keep sitting. Rice will cook by itself. Will it cook?
No.
Praise it that for hours, days, weeks. No, you have to turn on. Same thing. You have to work with your child unless and until the child will be fixated. Age will be added, he'll grow. He'll be fixated. The problem cannot rectified automatically. So the early, it doesn't mean now people are or new parents and all. The child is 1.5 years, my child is not talking, I'll take them to special people. No, not that early. But at least the milestones, like at the age of 5, what the child is supposed to do, speak, know certain concepts and all. If child is not doing, give 1 or 2 more months extra. Go to your pediatrician, let pediatrician take the call. Nowadays pediatricians are also well aware. They send it to psychologists also.
Yes,
so that is the process happening. Just do the follow-ons. Don't be in denials and don't just stop over there.
So do you think is there enough support from the public, or how can we improvise? Like public, what I mean is like schools or government or resource rooms as such. Are there enough support, or you think it has to be improvised like that?
So nowadays I'm happy with the governments all over. They have imposed on all the schools to have compulsory special educator and a psychologist in their school. So in that way, earlier it was only for IG schools or ICSE and international boards. Then it came for CBSE, and now even with our state government schools also.
Okay.
So in that way, the awareness has spread, and even government is working on the betterment for the teachers.
Okay.
Earlier it was only one person who would out of their own will, they will go take up the course and join as a special educator.
Okay.
Nowadays, the government approached the associations who train the teachers in school itself.
Okay.
And accommodate them with ideas and tips and techniques, so that the teachers can inculcate in class also. Where very mild children also, with little help also, they will start showing their improvements. So it is happening, and it is in a way good now. Earlier when we studied, we never heard about special educators or anything. But now it is coming into limelight, and people know why it is important and how useful it is.
Okay.
So yes, there is, because of lots of awareness and so many things happening around. I could talk about in last 1 decade.
Okay.
Things have come out, people have opened up, they are giving us the space, they are accepting, resources are being provided.
That's great, isn't it? So now what the parents have to do, the parents' job is to choose the correct person for the child's special needs.
More than choosing, First thing is like they need to accept. Now, it's not, nothing is going to happen automatically. Yeah, if like this term the child was not feeling well, he scored less. Second term child was well, he scored better. So they don't have to worry. Consistently downfall according to the age. The child is not performing. The child is underage. The studies, the learning is underage. The parents need to take a stand. These are all red flags. The child is way behind their age. Comprehension is bad. The child is not able to learn the way the child is supposed to learn. The child is not able to write the way the child is supposed to write. Now, a 8-9 years old child is still having problem writing in 2 lines with a pen. That is a problem. Child is only comfortable writing with a pencil in a 4 lines.
Okay. So those are not like alarming problems. Those are problems which can be rectified.
Yeah, but at the age of 9 years, the child is still in 4 years.
Yeah. Which
Already 5 years gone. So what this 5 years the parents were doing? They were still giving that allotments, adjustments. Otherwise, at the very end, like by 6 or 7 years, they would have, found it out. Why my child is not better,
Improved.
writing in 2 lines, or why the child is still lagging behind.
Oh.
It is in denial. It will happen by itself, it will happen by itself.
That's not
That's not happening. So they should do that, and they should, search. Google is not only like surfing for your shopping or your recipes or celebrities or whatever. You get this also, like good people around you. You don't have to go far. Psychologists around you, special educators around you, associations around you.
Okay.
Who do this.
So all the parents have to do is have an open outlook, and look out for people and accept the fact which can be rectified.
Very true. And they once they are starting, they shouldn't. I went and I came off.
That's not what should be.
No. If something is required, they need to carry
Full
forward.
100%.
Yes, and that would be definitely improvement in the child, but not immediately. They think many parents think special educators are magicians. Today I am sending my child, next week my child will start doing everything. No, it takes some time, but definitely there will be difference. So they should understand the concept behind a special educator.
Also the parents.
Yeah, everything. And then they need to support their child. It's not only everything grade based. If your child is very good in other activities, okay, keep that as a strength and bring it in his studies. That is what a special educator does. We look out for their strengths. Keeping the strengths in their mind, we work on their needs. They like to draw, bring in ABCDs in drawings. They like to sing, teach them spellings with rhymings.
Okay.
Nothing.
So there is way for everything.
Yeah.
You just have to find the right.
You have to change the way
patience.
how we look at it.
Okay. So have you faced any kind of challenges or problems like while working with paraprofessionals? Paraprofessionals meaning like your fellow special educators or psychologists or student counselors or even teachers for that meaning, be it school setup or outside. Have you faced any kind of to coordinate or understanding or ego clashes like that?
In school, especially with teacher setups, it would be like getting the time periods. All the teachers will be concerned about finishing their subjects, right? So when you call the child in that period, we have to make them understand. Some understand when they know the concept, what is happening in the resource room. Some don't. Working with a special educator, it might be every ways of teaching it might be different.
Yeah.
I might be having a different approach. My colleague might be having a different approach. So sometimes it happens very rarely, but once we come to know how we are supposed to work, or that I have to work with my set of children, she has to work with our set of children, then this mutual thing comes in.
Understanding.
Yeah. And when working with the psychologist of the school, if a psychologist is aware about what a special educator is and everything, then it is good, because both psychologist and special educator work hand in hand in school setups.
Yes.
Because the child first will be taken to psychologist, from psychologist only it comes to special educator. So the concept of learning difficulties, a psychologist need to be aware of. so that there will be a better understanding for them, and the referring and all, and even framing how what and all is required. Some children might need both
Yes.
counseling as well as special education.
Yes, yes.
So in that way they have to work together as a team, even the teachers, the coordinators, the counselors and special educators.
So teamwork.
Sometimes even the management, if they have got anything in their resource rooms, certain facilities, even management need to understand why it is required.
But have you personally faced any kind of challenges like that in your work experience?
I had little bit, because when I had to set up certain things in my resource room, but that's what I need to speak to a coordinator or a principal, and it has to put away, like I might have to wait for a day or a week, and then things were worked on.
It
worked. It sometimes it took time, sometimes it was prompt. There was even with like different other special educators, because I was like working in a part time, so when the other person was leaving I had to enter. So the setups and all the things were happening. Sometimes with teachers for the timetables, especially during the exam times, they won't be willing to send because they need to finish the portions, corrections, revisions and all. So we have to make them understand, and all those things was happening.
Okay. So still things, those areas has to be worked more, isn't it?
It's better if the teachers are aware of even the management and everything. It would be easy to start whatever is required.
At the end of the day, teachers also going to get benefited.
Yes.
The time won't be wasted. So like, after learning, so much, so what would you, educate the parents, or are they your fellow, parent coach or special educators, how to identify the students' needs at first place?
It cannot happen at first place. Just spend some time with the child, know about the child's behavior and the history from the parents, how consistent the child is behaving like this. If it is learning, how long it has been, how the child was in pre-KG, it was difficulty from the that nursery level for the child to understand or not, or when this has happened, was there something associated with it. So it is only like observing a child for a certain time, spending a time with the parents, knowing about it. Only then you can, come to a place where you think, okay, I need to do this kind of assessment with the child, like learning assessment and all, to just find out the child's actual position of learning and all.
Okay. So there is a way to learn the students' need, and you should follow that without any kind of break, and not to be in a hurry.
Yes, you need to follow certain types of protocol, I would say, wherein one by one you will be doing it, assessing the child for it, and then based on the severity you can conclude it, but not by tagging the child. There is no such we can call a child as dyslexic child. No, it is not a disease or nothing. No labeling, no tagging. Child with little bit of difficulty in learning. That's all.
So, and to end this session, I would like to know, like, what are the tips you would give the other, people who are watching this video, or the parents, like how to monitor the students or children progress, the growth, like how well they can improvise on the monitoring. How can they monitor by not just be doing a test or dictating, not like that, like in general, how can they, what is your take on that, and what would you educate, how will you educate on that?
See, first of all, parents should know, it is not only about if they are going to school and scoring good marks, the child is educated. It is more about learning and knowing how well the child is learning, how well the child is knowing that subject. So they shouldn't only just stick to the marks that they obtain in the school exams. They can do it like at bedtimes and all. I would ask many of my parents to do that. Have a me time, parent time or parent circle with the child, where you will ask the child about today's day, how the day went, what the child learned something new, or what he didn't knew till morning, now he knows something like that.
Apart from the subject, what you
Yes, some maybe a new word teacher would have used in the class, or some friend would have said something, or in that subject only teacher would have brought some good examples, or she would have shown a video. What was the child's learning from the day? So in that way they are encouraging child to speak about what they feel, what they think. Always give space and time to your child by listening to them. Don't just stop them by overpowering. I know everything. You are small. You know nothing.
Exactly.
Don't do that. Don't lock them out. Give them space to explore very well and see how brightly they come out. Don't always overpower. We always try to bring child to our age. That is not happening. We have to go to that level. Give that space, give that opening to them. Have always open-ended questions when you talk to a child.
Very good point, actually.
Day was good? The child will say yes or no. How was your day? All teachers came. So what was new happened in your class? Something like that.
Make the prompt.
Yeah, instead of finish your homework, today I got a complaint from your teacher, you are really bad, tomorrow I'm not going to take you out. Don't do all such things. Don't take them directly. Oh, how was your day? So, did you get homework and all? Sad, no, you have been loaded with homeworks. That's okay. Did you finish or come, we'll do it together. Something like that. Nowadays it is like, it's been a routine. A child is sent to the school, once he is back, he is sent to the tuition. The child's learning is over. Who guarantees the child is learning actually happening at the tuitions also? If the child is not able to relate, for the child it would be only symbols, whether it is in school or
Just
in tuition
because.
or anything. Nothing else is happening. So parents, I spend so much on you. I spend so much on you in school. I spend so much for you in tuitions. I do this, that. Is the child asking? Does the child even know what is spending known as? You're teaching.
Yeah.
Right? You're comparing. It's like Bata system. I'm giving you this, you give me your marks. Don't do that.
That's not the way it should be, isn't it? We bring the child into this world.
Right. So let the child know why. Purpose of child going to the school. Did you tell them why the child? You are going to school. You have to score first. See that auntie. See that child. You have to get that marks. I was the topper. You have to be topper. What we are training them and why we are sending them to school. It's like learning. You learn so many different things. You might be good learner than me. Don't stop yourself. It's okay if your marks are less. Doesn't matter. Even once I had very low marks only. Then only I started scoring better. Something like that. Give positivity. See how the child works.
So like by the way tips you're saying, like monitoring is by allowing them to talk and allowing them to explore is one way of monitoring them. One way of having a track on how well they are progressing, how well the growth is, not just by looking into marks or not just by looking at the report card. By allowing them to talk, by allowing them to explore, by also listening to them. Is that all what you wanted to convey?
It's not confined to only their marks what they bring in. What they have learned, they might come up with even better ideas.
Which will awestruck actually.
Yeah, so that and all you have to see. Child repeatedly says, okay mama, I'll go to school, but instead of tuition, send me to dance class. It's okay, weekly 1 day or 2 days you can arrange for a dance class. And say, okay, I'm sending you to dance class, but your study shouldn't be affected. We will do it together when you're back, don't get tired. Something like that.
So some kind of compromises the parents should also make.
Yeah, but in a way, not like telling them, I'm sending you to dance. You have to study when you come back. 3 hours you have to sit and compensate.
The
not
way
like
of
that.
Talking should change actually.
Yeah. We are not ordering or come. They have not come to the world just to fulfill our commands and listen to us in that way. We are not in military person. Even military person don't do that.
Exactly.
Like they are our children. They look on us with some meaning. They should know the purpose why they are in this world.
Exactly.
How will the child come to know my life is hell? My parents are not good. My life is not good. Nowadays, you are hearing 6-7 years of old children, they talk about committing suicide. My life is not good. My parents are not listening to me.
They don't like me.
When they came to world, they had such ideas. No, it was we, the parent, the way we gave them that.
Plant that ideas on.
Yeah. So the child is not blamed. You cannot hold the child. Who gave you this idea? Tell me. It shouldn't be like that. Where did I go wrong? And not educating you or not giving you such kind of information, making you feel that your life is hell. I'm not approachable. Okay. So for me, I might sound rude to many who are listening to us and viewing us, but for me, when parents come with a child, they have all blamings on the children, but my questions goes on to parents and their parenting. Some come without mobile, my child don't eat or sleep. My very first question is, Was the child born with a mobile?
Exactly.
No, we gave them. When I'm giving something, you should make them understand the limitations. Communication. Stop ordering your children, start communicating.
Communicate.
Half of your problems you're facing with your child will come to end. You will see
Exactly.
drastic change.
Definitely.
That's all.
Thank you, Sejal. Thank you so much for your time. So, what I would like to conclude, summarize from what you told. The first thing is acceptance. Acceptance solves most of the problem, like you said. And secondly, it's like communicating, conversing with your, your fellow people, at either be it your husband or be it your wife, be it anyone for that matter, especially your children. Communicating, not demanding or not, putting orders. You just have to communicate and understand their level mental capacity also. So this is your takeaway from me as well as a parent, and also for the people who are watching this video. Thank you so much.
Thank you so much.